What are some of the skills you need to pass the Ohio State Nursing Assistant test? Well, skill 17 is one of them. You want to learn more? Stay tuned and watch this episode. Hi, I'm Nurse Amy and welcome to my channel. So today we're going to be talking about skills number 17 and it is called partial bed bath. So in the state of Ohio, as opposed to doing a full bed bath, it's been broken up into sections. So you have the partial bed bath, you have the perineal area. So that, like when I went to school, well, it wasn't in Ohio, that was in Washington, D.C. We actually had full bed bath. That was many years ago. So we had to do from the top of the head all the way to the feet. But now it's not being done that way. So I think some states still kind of do full bed bath. I'm not sure, I can check on that. But if you have the answer to that, please leave it at the bottom and share the information you have. Again, welcome to my channel. If this is your first time, hi, I'm Nurse Amy. And if you're a repeat offender, you're welcome. Please remember to subscribe, like my videos, share it to your friends, your colleagues at work, even to other nursing assistants in school. I want to get as much information and as much tidbits and teaching the technique of the skill to as many healthcare professionals, especially nursing assistants, as much as I can. So again, we're talking about skill 17 and it is partial bed bath. What are the things that you need to know? First of all, I always tell my students this. If you don't know the technique of the skill, the steps don't matter. But you make sure that every emboldened part in your skills book, which in the case of the state is the red book, some people call it the Bible. That's what you go by. Again, as you follow my videos and my teachings, you start to realize there are techniques to the skill that I teach. And if you know those techniques, you can't fail. Again, I'm here to help you. So let's go to the skill and then we'll come back and talk some more. And then I'll be sure to give you a cookie point for this episode. Hello, Miss Trinity. How are you today? My name is Amy and I'm your nursing assistant. I'm here to do a partial bed bath. Before I do anything, I'm just going to wash my hands, pull the privacy curtain for our privacy, and I'll just go get my supplies. Okay, so I'm back with the supply, and what I try to do is actually place my supplies the way I'm going to need them. So I have a bath blanket, I have my washcloth, and what I try to do is 6 to 8 washcloth. I like to go for excess, okay? And then we have the 2 to 3 medium-sized towels. I have my soap. I always use a barrier because this table is used for eating, so I tend to want to cover it up. And then I have my basin of warm water, which I already tested the temperature. So I'm going to also have my patient test the temperature. Now, it doesn't matter. At this time, I'm actually using a mannequin, but when you're being tested, it's going to be a live person. So I need you to understand that. You're actually going to wash a live person. And the reason why I'm using a mannequin is because I want to teach you the technique. Now, remember, I teach you the technique of the skill on how to actually do the washing, okay? So I'm going to, I also have my linen hamper and my trash can. Anytime I'm doing anything near the bed that has to do with linen or washing, or I might be changing something, I have my linen hamper and my basket, my trash can. So again, as usual, I'm going to pick a side. And this time I'm picking this side, so I'm going to go over there and raise the side rail. Using proper body mechanics, squat it. Do not bend at the waist. So my patient is centered and aligned. She's comfortable. She doesn't have pain. Again, the side I pick controls the movements. This is just how I do things. For this skill, I should be raising the side rail up to mid-thigh and waist level. Not the side rail, sorry, the bed. I'm raising the bed up to mid-thigh and waist level. Now I'm going to bring my my overbed table to the side. Now, if I wasn't working with water, I tend to leave my overbed table at the foot of the bed. But anytime I have to do water, I tend to bring it close to me just so I'm not, you know, spilling water anywhere. So having said this, so now I look at my table, I have the bath towel. So before I place this, so I'm gonna go ahead and place this over my patient. And then at this time, before I take this off, because I have a bath towel, I have to pull this down, I have to raise this bed. Again, using proper body mechanics. Yes, you're doing okay, ma'am? You're fine. It's okay to talk to the mannequin, okay? Like a real person. Do you want me to raise your head up a little bit? And we can do that. She wants her head raised up. Again, she's safe, she's secure. We've got the side rail over there and I'm acting as a side rail. So at this time, I'm going to move this away from her so I can work better with her. Keeping my patient covered at all times. This is important. Also, I'm going to undress my patient. Again, I'm using a mannequin, so we're gonna have to be creative here. If you're doing your testing, it would be a live person. I'm going to remove the gown. Careful not to touch my uniform. And that goes in the soiled linen hamper. Okay. All right, ma'am. Patient is centered and aligned. Patient is comfortable. Patient denies pain. So now I'm ready to do my skill. Now for the face, we do not use soap, okay? It's only water. So that's what we're gonna be doing. So before I start to do my skill and wash her, I'm gonna have my patient test the water. Is the water okay? She says it is. It's warm enough. So now I'm going to wash the face. Again, remember we don't use soap. So there is a technique that I teach, the leaflet method. So again, I have a washcloth, I fold it into 4. At the open side, the free flowing side, we have leaflets here, okay? So now what I'm gonna do is, I make it, some people say it's like a burrito, and that's fine. But I make it like an arrow, like I have my hand at the back, and I'm using the opposite side. So at this time, gently, you know, you can place your hand gently over the person's head. Of course, ask them if it's okay. Is it okay for me to place my hand here before I wash you? She says it's fine. So we're gonna do the inner eye. From the inner eye to the outer eye, of the eye closest to me. So that is one leaflet. Now I'm going to use the second part. The second part, I'm doing the opposite eye, from the inner to the outer. So that was the second leaflet. Now I'm doing the third leaflet. And what I'm gonna do is, I'm gonna do from the middle of the forehead all the way to the chin. Okay, so that's 3. And then the fourth one, I'm gonna do what I did here, just the opposite. Again, just being careful. And then to the chin. So that's 4. So what I do now, the whole idea is just to use different sides at different times. So what I do, I flip the washcloth to sides that I've not used, And now I'm gonna do this part to the top of the lip. Okay, that was 4, and then, sorry, that was 5, and then 6. Okay. So I'm just gonna go through it again. So something that I do, you can count it. I have 6 sides altogether. Okay, so this is just for the purpose of reiterating the point. First leaflet, this is 1. Second leaflet, this is 2. Third leaflet is from here to here. Fourth leaflet is from doing the opposite side to the bottom of the lip. So we used 4. And then now we have 5 and 6. So 5 goes here to the top of the lip. 6 goes the opposite side of the nose to the top of the lip. And we're done. So that goes in the soiled linen hamper. And then now I'm just gonna wipe dry. Now it's up to you. Sometimes I tend to repeat the same thing just so you get used to this method, or you can just wipe dry. Okay. Wipe dry, not using too much force, because remember, this is the face. And we're done here. So the next thing is we're ready to wash the arm and the hand. So I'm gonna have this towel under her to protect the her linen, her bed linen. Okay, so ignore mannequin's hand is a bit bandaged up, but that's fine. We're just here to learn about the skills. Okay, so for this now, we're gonna use soap. So I'm gonna take, and this is a technique, you need to be mindful of this. I'm gonna take the washcloth, get enough. You don't want it dripping everywhere. Wring it, there's enough water, but it's not dripping. And then you take your soap. You mustn't have soap. Soap must never get into the water, okay? And you can't have, so one way to prevent that is move it away from the basin, okay? And you can do the leaflets like this, and that's fine. For each one, or just one big one. One thing I will tell you, don't make it too soapy. Do you see I'm moving away from the basin, but there's enough lather, okay? Now for me, it's just about consistency. We can do the whole leaflet thing. Okay, it's up to you. But I'll go ahead and do that just so you remember from the last one. Okay, picking up the arm. That's 1. That's 2. That's 3. Because remember, the arm is like a cylindrical thing, so I've been able to get everything. And then now I'm gonna get the hand. Now make sure you get the hand in between the fingers. So that's all 4 I've used. So I'm gonna turn it around. I'm gonna get her palm. So this is 5. Now remember, I have 6. You can just go back, get in the tips. And I'm done here. Now I'm going to rinse. Wet it. Again, you can do that leaflet if you want. That's what I'm going to do. Have the arm up. Make sure I'm rinsing real good. That's 1. That's 2 under the arm. That's 2. I'm going to go back to the side. That's 3. I have 1 more leaflet. I'm just gonna get this part, rinse it. Now remember, I have 5 and 6. Turn the palm. See, I have 6. I'm gonna go over and make sure I get everything. Get in the tips of the fingers, the nails. And that's it. Now we're gonna dry. We're just gonna pet dry. Again, I'm just using, it's up to you. You can use the leaflets. It's dry. Or you can just use 4 different sides of the washcloth. But the thing is to make sure you get every nook and crevice. It's dry. Now mind you, I could have used this if I wanted. That's an option. So now we're gonna do the underarm. Again, wet it. Do not put soap over the water, just enough water to hold the lather. Lather it. 1, 2, 3, 4. Now I'm going to rinse. One, 2, 3, 4. I'm gonna dry. I'm just gonna go ahead and dry with this. And we're done with the skill. However, again, look at the table. If you're not sure, just keep looking at your table. Your table will point you in the right direction. So I see the table, I see a gown. So that means I have to dress my patient. Put the gown over. Careful not to shake. Put the gown over the back towel and dress. You okay, man? You still doing okay? She says she's fine. I'm just going to tie this behind you, man. Okay, so now I have to take the back towel off, okay? That was a privacy blanket, privacy towel, because now she's dressed. So again, as usual, I take it from under her. Careful not to touch my uniform. Again, goes in the soiled linen. Cover my patient up. Do you want your covers, ma'am? She says yes. The next thing to do is I'm going to go ahead. This is all soiled now. It cannot go back to the storage. So next thing I'm gonna do is take this bed down for her safety. Patient is centered and aligned. She's got good body alignment. Now I have to dispose of the water, but before I do so, I need to unrestrain her. You okay, ma'am? You want your head up? She says she's fine. And so now I'm going to give her her call light. Go on the other side. I'll go dispose of my water. I'll be right back. Okay. If you need me, just use that. Okay. Hi, ma'am. I'm back. Do you feel good? All right. I'm glad you liked your bath. You okay? Patient is centered and aligned. Patient giving call light. Call light is within reach. Are you in pain, ma'am? He says no. She denies pain. So at this time, bed is low. Making sure bed is low. Okay. Patient is unrestrained. Wash your hands and I'm done. Again, welcome back. Before I forget, what's the cookie point for this episode? Well, the cookie point is, remember, no matter what you do, always remember to address the person in a very respectful way. I would say this. A lot of you sometimes forget. Doing all that baby talk, honey, dearie, sweetheart, is very rude and it's very patronizing. And it's one of those barriers to communication. So remember the populace you're going to be dealing with. A lot of them are much older than you and they're old school. Much like I am. I'm old school. Not as old as the populace you're dealing with, but I'm old school. I grew up in the time where ma'am, sir, I had to do those things. I mean, it's just the way I was raised, and if you don't know someone's name, you address them. It doesn't matter if they're younger or older than you. You have to be respectful. If you know their name is Miss this or Mrs. this person, Mr. this person or Mr. that person. So that's my cookie point. Make sure you greet people in a respectful manner in the way they want to be addressed. Now, if they tell you they want you calling them honey, sugar, and they've given you permission to do so. Okay. I personally don't want to be talked down to. I don't want baby gobbles because I'm not a baby. I don't want people calling me sometimes by my name, especially if I'm older than you. I think I've earned that respect that you can call me Miss, Auntie. When I say Miss against my name, or ma'am. I actually don't mind being called ma'am. I know a lot of ladies don't like that. I don't mind. You can call me ma'am. That's fine. It's just, again, that I believe that's respect. So until I come your way again, I hope you're washing your hands, you're wearing your masks. And if you have any questions, you can reach me directly. Write to me directly at nurseamyacademy@gmail.com. Follow my podcast. There's a lot that we talk about there. I've got interviews and everything. Okay. Make sure you tune in anywhere there's a podcast platform. It's Nurse Amy Online. Follow me, subscribe, rate me 5 stars. Please support me. I want to keep on giving out this information and your support goes a long way. So again, you can follow me on Instagram and Twitter at Nurse Amy Academy. And then on my podcast, I think I already said that, is Nurse Amy Online. So it's on anchor.fm, it's on Apple Podcast, on Google Podcast, also on Spotify. So remember, you're the only one who can limit yourself. So why do so? Why limit yourself? I am your biggest cheerleader. Until I come your way again, mask up, be responsible. Take care. God bless.